Hi guys, Dr. Nick here. During my stay here in Switzerland, I'm interning at the Alpstein clinic, and today was my first day. And I just want to give you kind of an analysis or kind of a rundown of how my day went overall, because it was pretty cool. I really enjoyed it. I really enjoyed the atmosphere there. So first thing, got into the building. Everybody kind of just said hi to me right away. Came up to me because it seems like they were anticipating me. So I was kind of shocked by that in terms of everybody that worked there. The second thing too, when I got a chance to shadow Dr. Ralph Ottmeyer, specialist in integrative biological medicine, and that's what the whole clinic's about. And it's really a team atmosphere. I think that's the biggest thing that take-home messages from today was that everything they do is about team, because even when you come there in terms of having a program done on you, specifically for cancer, for chronic illness, or just kind of a holistic kind of upbuilding or just preventative wellness program, is that you always see more than one doctor. And even in terms of their head doctors, you always see more than one, just because of the fact that everybody has a unique style of medicine in terms of physicians and doctors, so that sometimes we miss stuff, or sometimes somebody sees things a little bit differently. So when you have different opinions or different ways to objectify or see a patient, it gives you more of an ability to kind of really hone in. So maybe one person's a specialist in homeopathy, so they have a different angle on how they see the patient, or maybe somebody's a specialist in kind of say injection therapy, so they can focus and find interference field and treat those more directly. So I really appreciate that. And of course, in this clinic, they integrate biological dentistry, which is a huge part, and it's still an evolving area. It's still a little bit confusing because dentistry is just a huge area, and especially with the toxicity part and the biocompatible part, there's still more research to be done in order to have the best answers, especially in implantology. But starting with Dr. Ralph, I really appreciated the style of what he does. So I got a chance to sit on a new patient with him. But just starting my day, we had a patient who's been there for over a week, another physician actually from America, coming to get treatment, and they really appreciated the way he does medicine and the way the clinic is run and all the clinic staff. And then in the morning, so did an injection for the adrenals and for the thyroid for upbuilding and kind of an organopeptides to help support that. And also the second patient, I think, was an interesting patient. They were a cancer patient, stage 4 breast cancer. Huge side effects from chemotherapies. They've done even in a local university hospital here in Switzerland, where they came from the Middle East to kind of get treatment. And they finally decided to kind of come to the Alpstein clinic. And I saw right away Dr. Ralph, his style of approaching it. So he prepped for the appointment, and that's what I really appreciate in terms of understanding what has been on in terms of all the data that he got from the patient in terms of scans, stages, and all that stuff for the cancer. And then the second part he always thought about is the psychological part of the patient, where it's coming from. But even during that part, he also wants to understand the oral pathology that might be involved with that patient. So right away, even before he saw that patient, they went through the dentist, Dr. Joseph, here at the Alpstein Clinic, and he does a thorough examination because he's a medical doctor. And then after becoming a medical doctor, he went back to dental school, which is pretty profound, because he realized that the majority of the pathology is from the neck up, so he really wanted to focus on that. So after that thorough examination, Dr. Ralph got the chance to see her, and then he went through her history. And again, this person had a translator, which was really interesting. So it was a translator from, I think, from an Arabic language into German. So I didn't really understand everything, but I understand the expressions and also the patient's face, which was really huge. And I appreciate that Dr. Ralph also goes into the psychology of things. And even when he does treatments, he always looks at the psycho-emotional parts. So even when he's doing an injection treatment, it's not just to do an injection, but then he does affirmations after it, which I feel really supports the patient, and the patients really enjoy it, or they really appreciate it, because this woman um, um, was really going through a lot of turmoil, even just from the toxic side effects of chemotherapy that she previously done in terms of where she's at. But and also Dr. Alf asked her, why do you think you have this cancer? And even from her perspective, she thinks um, she thought there's an emotional component to it, which I really appreciate, because again, we have to go after every part of the person, not just the physical, but there's emotional, and then there's the energetic parts, and that is really looked after in terms of going forward with Dr. Ralph and his patients. And of course, he did a physical exam on the patient, seeing what's going on, focused one, and then even after that, where he told me too, he usually doesn't do a treatment that first physical day, but person had a huge scar on their back because there was metastasis to the thoracic spine, and he just felt that he had to do it because there was tightness and pain with that scar. And then right after he did that, the patient actually really appreciated that, and also with the affirmations, and also being mindful of the culture and the religion, which was really cool, because he really does pay attention to that in terms of patients and making them feel comfortable as much. And then the patient really felt a connection even at that first appointment, and was always saying, even in English, the little that she knew, thank you doctor. And there was a change even after that appointment, even with a simple therapy. And then even for further diagnosis, they still do they run a lot of different diagnostic testing in terms of heavy metals, in terms of xenoestrogens, in terms of like different plastics, like we're talking about with xenoestrogens, and then also immunological microbial panels towards different possible infections might be part of the etiology of where things are at. And then of course gut tests too, because that is a big part, especially with chemotherapy. It can really deplete the gut lining and create leaky gut in simple terms. So they're very comprehensive. And then after that, his goal is always to come up with a plan for that patient. So he takes time after the appointment to be able to do that. And that's what we saw. But even during this appointment, the first one, he even did live blood analysis, which I think the patient really appreciated, because there are some parts that they can really understand and say, okay, yeah, I think that is happening, and that's what I feel. So it was good to showcase something to the patient that moment, which kind of gives them more of a understanding of what's going on, and makes them understand of what their condition is, and his thought process of where he wants to go after these preliminary results. And then of course there's a battery of tests that they do in the clinic, which is HRV, heart rate variability. They do also thermography, regulation thermography, and then many other testing that is needed. So it was really cool to see that, and just his approach overall, because that's something that I really appreciate, the comprehensiveness of what's going on, but also just the human feeling towards it. It's not just a physical kind of patient that you don't feel any rapport with, but he tries to build rapport and an emotional connection, so there's more trust going forward. So that was really great to see overall. And then again, one of the last patients today that we saw, he didn't do any injections. He did manual therapies on him. So even from chiropractic to different osteopathic techniques to help support their structure, and also in terms of helping support their acute pain that was going on. So overall, it was a great day. It was a great understanding of what's going on. Just an overview. And then next week I'll have more of a chance to dive into different sectors of the clinic to be able to see what's going on and get a little more detail into the different therapeutic therapies they do, or techniques, and different things that they use at the clinic. And I'll try my best to share with you as we go along what's going on, and try to give you an update kind of after every day, just so you can kind of get an understanding of what they do at this clinic too, because I'm hoping, of course, one day to have something of this nature in Canada, because I am from Canada and I want to bring it there. So again, thanks for taking the time to watch this, and then for tonight, Dr. Nick signing off.